Hi, everybody. Welcome. We're going to be getting started in 30 seconds. Hello, good morning, good afternoon. My name is Darla Bardine, and I'm the Executive Director of the National Network for Youth, and it is my pleasure to welcome you to our webinar today, Strengthening Support for Youth. Learn about the Runaway and Homeless Youth Trafficking Prevention Act. The webinar will be from 2 to 3 Eastern Time. Next slide, please. And please introduce yourselves in chat. If you could please put your name, your pronouns, if you're with an organization, where you're located in the world, and include an emoji to show how your day is going so far. We have allowed several times for questions and answer throughout our presentation today. So please put your questions in the Q&A box at any point throughout the presentation. Also, we are recording this webinar. It will be available later. We also have the slides that are available and will be shared now in chat. And we'll also follow up to everybody with the slides. Also, there will be a post-webinar survey. Please complete the survey. Let us know how we did, how we can improve, and what topics you're interested in for our next webinar. Next slide, please. So first, we're going to do an introduction, and then Trinity is going to provide an overview of youth homelessness, and Liz will talk about the Runaway and Homeless Youth Act program. Then I'm going to talk about the bill, the legislation itself, the Runaway and Homeless Youth Trafficking Prevention Act. Then Trinity is going to talk us through the strategy, the path forward of how we get this bill through Congress and signed into law. And then there'll be additional time for Q&A at the end. There will also be time for Q&A after the overview of the Runaway and Homeless Youth Trafficking Prevention Act. So for those of you who are not familiar with the National Network for Youth, it's my pleasure to let you know a little bit more about our work as an organization. We're a 51-year-old organization. We're on a mission to transform systems so that no young person in America experiences homelessness. To accomplish our mission, we partner with young people with lived expertise of homelessness, as well as community-based and system use service providers across the country. We advance federal, local, state policy. We work in partnership with young people with lived expertise of homelessness, and we also provide support directly to communities on the ground. And with that, I will pass to Trinity.
Thanks, Darla. Hello, everyone. My name is Trinity Maddock, and I'm the Senior Policy Associate here at the National Network for Youth. So I just want to start us off by setting the stage for the scope of the issue of youth homelessness, so we can all really see how important the Runaway and Homeless Youth Act program and the funding are, and of course, the bill that we're going to be talking about today. So national estimates from studies at Chapin Hall show that approximately 4.2 million young people between the ages of 13 to 25 experience homelessness each year. And of the 18 to 25-year-olds, at least 20% have experienced trafficking as well as homelessness. Now, the issue doesn't only affect youth and young adults. A very high percentage of young people experiencing homelessness are pregnant or parenting. National estimates point at 1.1 million minors each year, and early childhood programs actually counted 447,000 infants and toddlers experiencing homelessness with their families in 2022 to 23. Now, the experience of a homelessness, particularly as a young person, can be very detrimental to the future success and stability of that youth. They'll have an increased likelihood of experiencing homelessness chronically as an adult, increased likelihood of involvement in other systems, child welfare, juvenile justice, criminal justice, an increased likelihood of substance use disorder or poor mental health or other health outcomes, and a decrease increased likelihood of educational attainment and employment. So this is what our young people and our youth providers are fighting against, and that's why the programs and the bill that we're talking about today is so important. So with that, I'm going to turn it over to Edelvina or Liz, who is a longtime member of National Network for Youth's National Youth Advisory Council. This is our council comprised of 8 young leaders from across the country who guide our federal policy work. So Liz, take it away.
Hi, everyone. Um, Thank you so much for having me here today. I was excited to accept this invitation to present today because I actually benefited from the federal Runaway and Homeless Youth Act program. I know when I was a young person, I experienced homelessness with my son, and I wasn't able to get the help that I needed at first because our homelessness was like more hidden, and we were not eligible for programs funded through the U.S. Department of Housing and Urban Development. Urban Development Homelessness Assistance Program. So this was what made it difficult for us and made our exit from homeless more difficult and prolonged it than it needed to be. After trying to get help and being turned away, I was actually finally able to get the help my son and I needed from an RHYA funded program who helped me with housing, but so many other things as well. It wasn't just housing. Most important to me was actually the case manager that helped me through this, who truly cared for me without judgment. And it was someone I can still turn to this day. Like, last week I just went to her about a couple things. So after several years of support, I have now been actually living with my on my own in my own apartment for years now with my kiddo. And there's that a little bit about what my story. So the runaway now sorry now I want to share about the Runaway and Homeless Youth Act, or the RHYA program. So the RHYA is a federal funded that funds local organizations that provides housing and supportive services to youth, young adults, and young parent families experiencing homelessness. It was created in 1974, so RHYA is a 51-year-old program. RHYA funding is overseen by the U.S. Department of Health and Human Services, and it is currently funded at a 146.3 million. And the last time it was authorized was in 2018. The first funding stream is the Street Outreach Program, or SOP. So street outreach programs helps train outreach workers connect with youth living on the streets and build trust and guide them to safety. This funding can also support drop-in centers, a critical connection point for youth. A core goal of SOP is to prevent youth from becoming victims of sexual abuse, trafficking, or violence. Outreach staff connect youth to essential services such as food, shelter, healthcare, and counseling. Drop-in centers can also be Drop-in centers can also be funded through the SOP grant and often provide youth with a first safe place, starting the path towards stability. The second program I want to talk about is the Basic Center Program, or BCP. Basic Center programs provide immediate short-term shelters up to 21 days for youth under 18 who are in crisis and experiencing homelessness. The BCP also ensures that youth have access to food, clothing, hygiene products, and a safe place to sleep. When safe and appropriate, BCPs work to reunify youth with their families through counseling and strength-based family interventions. BCP also provides the follow-up support to ensure that youth transition to stable long-term housing and don't return to homelessness. The next RHYA funded stream I want to talk about funds both transitional house living programs or TLP and maternity group homes or MGH. So transitional living programs and maternity group homes provide up to 21 months of stable housing for youth ages 16 through 22, supporting their transition to independence. In these programs, youth receive case management, educational support, job readiness training, life skills development, and access to mental health and healthcare services. Maternity group homes provide specialized housing and services for pregnant and parenting youth, supporting two generations at once. These programs help young people build a foundation for long term stability and success. RHYA also funds the National Communication System operation by the National Runaway Safe Line, or NRS. NRS provides confidential support via phone, text, and chat for runaway, homeless, and at risk youth and their families. The Safe Line connects young people to shelters, services, and support networks in their community. NRS also helps youth communicate with their families and service providers to facilitate reunification or safe placement when appropriate. RHYA also funds additional functions that support the RHYA grantees and the program generally. So RHYA funds national, regional, and local trainings and technical supports for service providers to deliver a high quality trauma informed care. RHYA supports integrancy, sorry, a coordination to ensure youth experiencing homelessness have access to healthcare, education, employment, and housing. And ongoing evaluations help ensure RHYA funded programs are evidence based, effective, and responsive to the needs of youth. RHYA supports innovative demonstration grants, including those tailored to rural communities, to test the scale promising practices. RHYA supports research on the scope, needs, and characteristics of youth experiencing homelessness to inform policy and program developments. And now I turn it back to Trinity.
Thank you so much, Liz. So just a little bit more info about the Runaway and Homeless Youth Act program before I turn it over to Darla to talk about the bill. So RHYA programs are very, very effective at what they do. I'm sure, any youth providers out there right now, I know you all collect your outcome metrics, but national outcome metrics from the Department of Health and Human Services show that across the board, Runaway and Homeless Youth Act programs are really effective. And this is really important information to share when you are speaking with your representatives, especially if you have Republican representatives, to show that this government program is efficient, it is effective, and the money is achieving the outcome that it's meant to. So anytime you can share outcome data like this, whether it's national data and or your own data, definitely should do so. Now, despite the program's success, it does unfortunately remain funded at a very low amount. And really what this means is that there are young people who are just slipping through the cracks, who maybe don't have an RHYA program near them, or maybe one near them doesn't have capacity. And we know that the issue is just directly caused by a lack of funding, a lack of resources. So RHYA programs nationally serve around 40,000 youth and young adults each year. But of course, this is just a small number out of the 4.2 million who are in need of services. So we always fight for increased funding. That fight is, of course, particularly difficult in this current political environment. But as you'll hear from Darla later, there are some updates in the bill that could help with our advocacy for overall funding levels and grant award amounts. All right, so with that, I'm going to turn it to Darla to talk about the bill itself.
Thank you, Trinity, and thank you, Liz, for talking earlier and educating us about the program. I have good news to share. We have a bill. It is introduced. It's bipartisan, bicameral. For those of you who haven't heard, that's called the Runaway and Homeless Youth and Trafficking Prevention Act of 2025. We have the bill numbers here, S2012 and HR 3856. And next slide, this is an overview and it also links to the actual bill text. The bill text in the Senate bills and the House bill are identical. That is critical, which Trinity will talk more about our strategy to get this bill to become a law. So these are pretty rough partisan times. So I think we should all celebrate and be excited to have a bipartisan, bicameral bill introduction that happened on June 10th. There's not too many bipartisan things happening now, let alone in the House and the Senate at the same time. So our Senate champions and our House champions are the same from last session to this session. So Senators Collins from Maine and Durbin from Illinois are the champions in the Senate. And we also had original co-sponsors. So we had 2 Republican original co-sponsors, 2 Democrat original co-sponsors. So again, this is another reason to celebrate, to have 3 Republican senators, 3 Democratic senators saying they support this bill and think it's important at introduction, is a really strong showing for a piece of legislation. And again, is not something that we're really seeing that much, if at all, these days. So our original co-sponsors were Senator Murkowski and Sullivan both from Alaska. And then we had Senator Warnock from Georgia and Blumenthal from Connecticut. And I guess Welch has joined since then, from Vermont. And then our champions in the House are Susan Bonamici from Oregon and then Don Bacon from Nebraska. And then we also had Representative McGarvey from Kentucky join as an original co-sponsor. So what this legislation does, or what a reauthorization is it basically reauthorizes and updates an existing federal program or an existing federal law. And typically, the law itself says, how often a bill should be reauthorized. So the Runaway and Homeless Youth Act says that it really should be reauthorized every 5 years. And you can tell that based on the authorization years of appropriations in a bill. And we're, like Trinity said, we're a little past due when this program, should be reauthorized. But we're going to do everything we can to get this bill to become a law, which Trinity will talk more about later. So now I want to talk about what the bill does. So the bill hasn't done this yet. The bill is not yet a law. But when this bill is signed into law, these are the changes that this legislation would make to the current Runaway and Homeless Youth Act programs, which Liz shared about. So the law would require that all the grants are 5 years, and that they would be staggered grants every 2 to 3 years apart. So it wouldn't be a 5-year wait to recompete, but once you are awarded a grant, it would be for 5 years. Also, we know that current grantees are told the day before, the day of, or even after their current grant ends, whether they get another grant or not. This law would actually require FISB to notify grantees 90 days before their current grant ends, whether they get a renewal grant or not. It would also establish an appeals process for unsuccessful applicants that feel that their application was incorrectly scored. Those last 2 things are not something FISB is excited about, but we think it's important because we have heard there's been how shall we say, lack of standardization and grant reviews. We also know it's highly competitive just because there is a limited amount of funding compared to the number of grantees that apply for the funding. It also does say that geographic distribution, equal geographic distribution has to be considered when issuing grants. That's very important to some of our champions who represent more rural states or district, ensuring that this money is not just going to big cities, but also going to suburban and rural communities as well. It also requires that programs provide training to their employees on human trafficking, trauma, sexual abuse, and assault. This is already pretty standard practice and required in regulation, so it's simply putting it in statute. It also would put in statute a mandatory non-discrimination practices, which again is currently in regulation, but it's not in law. So this would put that regulation into law. And then it does say that services must be trauma informed as well as age, gender, culturally, and linguistically appropriate. Again, this is already in regulation, but it would put it in statute. Next slide. So some street outreach specific programs. So right now the law says that the secretary may make grants, which means that the secretary doesn't have to disperse street outreach funding. Our bill would change that. So it would change it to the secretary shall make grants for the street outreach program. So that would mean it would be mandatory for the secretary to disperse funds for the street outreach program as long as Congress has appropriated those funds. Also, it would update the eligibility to include youth who have experienced trafficking. Probably doesn't change much about how the current program is operating. And it also adds the option of using online methods and social media to outreach to young people and to use street outreach funds for those services. And then we have included a quote here from a provider that we must build outreach teams to go out into the community to meet unhoused youth where they are. You cannot always expect them to find you. So just how critical it is to have this street outreach program, because a lot of young people in crisis, a lot of young people experiencing homelessness don't know where to go. And so that's why this program is so critical. And the Basic Center program, right now, the current law says that the Basic Center program is as an alternative to involving runaway and homeless youth in law enforcement, child welfare, mental health, and juvenile justice systems. And instead it says that services be provided to runaway youth, street youth, homeless youth, or youth at risk of separation from the family. Right now, we've just been hearing from providers that they've had a hard time serving young people that were ever involved in any of these systems, but are not currently in that system. So this is one way to kind of fix that issue. And then also we know that 21 days is often not a long enough length of stay for the Basic Center program. So this would increase the length of stay to 30 days or longer as state law allows. So if you have a state law or a license for providing housing to minors or shelter to minors, whatever the word they use, and it's maybe a 60-day length of stay, or you can be licensed to serve minors for 90 days, then this would allow that flexibility for you to use those federal funds for the length of stay that's allowed based on your state or local licensing and regulations. Next slide. So some updates to the transitional living and maternity group home program. So it would increase the age from 22 to 25, specifying provider discretion in offering services to youth who are 22 and older. And it does require that young people under the age of 22 are prioritized. And it also requires providing aftercare services to the extent possible, to the extent practical, including to youth who have relocated outside of your service area. And then we have a quote here from a provider about supporting youth while they learn skills, increase employment and earning potential, and cultivate the support in the community is essential for long-term success. Just saying how valuable and effective these programs are. So these are some changes that impact Basic Center, transitional living, and maternity group homes. So one, it specifies that it allows providers to include individuals identified by the youth as family in any counseling and therapeutic services. So it really kind of expands that definition beyond kind of biological family to the extent that it's helpful to include them and any of the counseling and therapeutic services that the grantees provide. Also, it increases coordination and services with McKinney-Vento homeless liaisons. It requires providers to assist youth in completing the free application for federal student aid if a young person wants help in completing the FAFSA. Can't make a young person fill out a FAFSA, but please help them when they ask. It is a very complicated form, even with a simplification. It also allows grantees to serve a minimum of 4 youth and a maximum of 20 youth per project, unless the regulation allows a higher maximum. Also, this has been a big issue. It also clarifies that grantees can have more than 20 beds in a building if that building contains multiple separate projects. So there are some programs that have multiple programs within a high rise or within their structure. And so maybe the building has 60 beds, but it's 3 20-bed programs or 4, programs with 20 beds or less. This clarifies and kind of fixes a regulation issue, allowing that to be okay. Next slide. Also, it makes just some minor changes to the National Communication System and the National Training and Technical Assistance. So for NRS, it would basically include the use of online methods and social media as ways to outreach youth. And then for RHYTPA, it would allow for training and technical assistance to be on-site and web-based, such as on-demand and online learning. And that requires that, and it also requires that trainings be trauma informed. Next slide. So some other changes. It requires HHS to release a report on the prevalence of youth homelessness every 3 years. It also gives the Secretary of HHS the authority to waive program requirements in the event of extraordinary circumstances, such as natural disasters, public health emergencies, or financial crisis. If you all remember, during the COVID pandemic, we really needed temporary waivers around length of stay, around age limits, because people, you were on under lock orders and folks were technically not complying with the law. So and we really needed Congress to act to add that flexibility. So this would not require Congress to act for there to be this flexibility if there's some type of extraordinary circumstances. It would actually give HHS the authority to temporarily waive program requirements. Also, providers that have been awarded grants for 5 consecutive years will have an evaluation, and it specifies that those evaluations can be virtual. And then the maximum grant for rural projects would increase from 100 million to 200 million. And then it also adds a new prevention services grant program. It's not a separate NOFO. How it was structured is that when you apply for a basic center or a TLP or an MGH grant, you would have the option of also applying for an additional $75,000 per year for the whole length of your grant to provide prevention services. And prevention services is defined to include a lot of different things, including individual, family, group, and peer counseling, family mediation, connecting youth to public services and housing options, emergency respite care, connecting youth to education and employment programs, case management and resource navigation, and activities to improve local mental health and substance use treatment prevention. Next slide. The other thing, so I wanted the difference between authorization and appropriations. So authorization is like this bill is a reauthorization. And in the legislation, it says a specific amount of money for each of the different programs. And once that bill becomes a law, say that it passes and there's 315 million in authorized funding for the Runaway and Homeless Youth Act funding program. That does not become real because the actual funding amount and funding levels for every federal program is determined through the annual appropriations process. So the funding level that's in an authorizing legislation or the law itself is basically the suggestion or recommendation to the Appropriations Committee. The Appropriations Committee sets overall funding levels, And then from there, then the different programs get their funding levels. So it's not like as soon as the bill passes, then we have like doubled our funding. That's not actually how it works. So right now, the Runaway and Homeless Youth Act is authorized at 152.4 million, and we're currently appropriated at 146.3 million. So our actual funded amount or appropriated amount is not at its current authorized amount. Next slide. So the authorization, so this bill would increase the funding level for the Runaway and Homeless Youth Act program. So the recommended funding level would become 319.5 million. So that's what the authorizing committees would be telling appropriations committee that that's the actual levels that this program is needed. So what that means is for the consolidated programs or BCP, TLP, and MGH would increase from 127.4 million to 200 million. It would increase the street outreach from 25 million to 50 million. And then there would be a new bucket of money, the 67.5 million for the prevention services program. And that's based on if every BCP, TLP, and MGH applied for and received the 75,000 a year, it would be the 67.5 million. And then it would specify that the every few year prevalence on youth homelessness would cost 2 million. So that would put a specific funding level in there. So we would still need to advocate each appropriation cycle for those funding levels, but you are in a much stronger position to advocate for increased appropriations when you have those increased authorization amounts in the base bill. The other thing is the actual grant awards themselves would increase. So if the Runaway and Homeless Youth Act is funded at less than 200 million like it is now, then the grants would be between 200 to 250,000 per year. If Congress does appropriate more than 200 million to the program, then the grant amounts would go from 225 to 275,000 per year. And the prevention services grant would remain at 75,000 per year, though, like I said, you could have three of them. If you have BCP, TLP, and MGH, you could have 3 times 75,000 per year to put into prevention services. Were there any questions, Trinity, that we should address now? Oh, here.
Yes, we have a couple about the coordination with McKinney-Vento.
Yeah, well, hopefully if you're an RHYA grantee, you're probably already coordinating with your McKinney-Vento homeless liaison. The bill basically says if you're not coordinating with your homeless liaison, then you should. So I don't think it would. Hopefully it doesn't change too much on what you're already doing. But it would be in law, and right now it's not actually in law.
And then
Yeah,
just to reiterate what I answered in chat, the source of funding for that prevalence study every 3 years, the bill recommends it to be 2 million from Congress. So when we come to that, 3-year mark, then we would need to appropriate that, or excuse me, advocate during appropriations that year for the 2 million.
yes, which we do already. Oh, so for the homeless liaison, so this bill doesn't put any requirements on homeless liaisons. This legislation applies to Runaway and Homeless Youth Act grantees. So the requirement, just to be clear, is for RHYA grantees to coordinate with their McKinney-Vento homeless liaisons. Hopefully that's already happening, but it doesn't put any requirements on homeless liaisons. That would be under the McKinney-Vento Education for Homeless Children and Youth Act program, which this does not change that in any way. Okay, and I'll turn it over to you, Trinity. Thanks.
Great. All right. I see a question in the chat. That's the timeline for communicating with your representative, which is a perfect segue into our next section here, which in which we're going to talk about the strategy for our collective advocacy to get RHYTPA passed this Congress. It's a strategy that involves everyone and everyone in our networks. We at National Network for Youth, we cannot do it alone. So we're going to talk about some different ways that everyone can get involved and how we can support you with whatever you need to take one or more of these actions. But I'll start by just setting the stage, the context that the bill exists in right now, and then the kind of step that it's on in the process of going from bill to law. So 2025 was the start of the 119th Congress. Each congressional session lasts for 2 years. So if RHYTPA does not pass by the end of 2026, then it will need to be reintroduced in the 120th Congress, which would begin January of 2027. So that's the kind of time frame that we're working in. We want everything done by the end of next year. Now, in this Congress, Republicans have a trifecta, so they have control of the House, the Senate, and the executive branch, so the president. But this doesn't mean that bipartisan support isn't important. Bipartisan support is still very important. We still need Democrat support to pass this bill. We are, of course, focusing quite a bit on building Republican relationships and support for this bill. But whether you're in a blue state or a red state, or like me in a purple state, your advocacy is definitely needed to help pass this bill. So here's the full process that we need to kind of shepherd RHYTPA through. So remember, like Darla said, it's just a bill, only a bill. It's sitting here on Capitol Hill. It's not a law yet. We have a lot of steps to get it through before the end goal, which is the president signing it into law. So you'll see that both the House and Senate are necessary to this process. As Darla mentioned earlier, we worked very diligently to ensure that RHYTPA was introduced in both chambers with the same bill text. So that gives us a huge leg up, and we really knocked out of the park this first steps. So then the next is the respective committees need to okay the bill, or they need to draft and agree on amendments to pass the bill out of their committees. Then the full House, full Senate need to vote on the bill. And if there are any differences, at that time between the House and the Senate bills, then both chambers will need to negotiate and agree on one finished product before they can send it to the president. So as I mentioned, we killed step one, bipartisan, bicameral introduction, same bill text. So now we're working here on step two, which is building that support for the bill within each of the committees so that they will vote to pass the bill out of their committee and it can move on to the next step. So on the House side, the committee that has jurisdiction over RHYTPA is the Committee on Education and Workforce. This committee is led by Representatives Tim Walberg from Michigan and Representative Bobby Scott from Virginia. If either of those two are your representative, you definitely want to reach out to them with one of the take actions we'll talk about. But in addition to them, I've listed other really important members on this committee to RHYTPA. These members down here are part of the subcommittee within the larger committee that's really going to take a close look at the bill and make the recommendation to the larger committee as to how to move forward. So we really need these members to co-sponsor RHYTPA. So if you see your representative listed here, we will share the slides. Please reach out to their office or to me if you need support in reaching out to them. Having their co-sponsorship is going to be key on the House side. Our strategy on the Senate side is actually to meet with all the members of the Senate Judiciary Committee, because that is kind of how the chair, Chuck Grassley, likes to run his committee, is to make sure everyone is on board. Many of the Republican members we have already met with. So if that's you, then thank you so much for joining us for those meetings. We're continuing to do follow-up to the Republican offices that we have met with. And we're going to begin meeting with Democrat offices in the next month or so. So if you see your senator on here, please still consider taking action in one of the ways that we'll go over. We need the senators on the Judiciary Committee to co-sponsor RHYTPA as well. Now, before I move on to some actions that you can take, I do want to clarify that if your House representative or your senator was not listed or they're not on one of these committees, that's totally okay. You still can and should ask them to co-sponsor the bill. The more members we have supporting the bill, the more likely it is to pass and become a law. And remember that the committee support is just step 2 in that big process. The full House and the full Senate will still need to vote. So we want to make sure everyone is aware of the bill, questions answered, they're excited about it, all of that. So again, if you don't see your members on the list, you can still take action. All right, so we are going to talk about those different actions, but I want to emphasize that no matter what you choose to do, the ask or the purpose of your action is to have your members of Congress co-sponsor the Runaway and Homeless Youth and Trafficking Prevention Act. So a co-sponsorship is like a public show of support for the bill. A senator or a House member will sign on to the bill as a co-sponsor, and you can see them on the bill's webpage. And it's really, really important to have as many co-sponsors as possible from both parties. So what you can do is look up your legislator using our lookup tool on our website. You can use your personal address, organization's address to find out who your members are. And do keep in mind that if your org is spread out or you have multiple locations, you may have more than one House representative. So just be sure to check, all your different locations. Okay, so the first 3 on here are very quick, very easy things that you can do right now. First, if you haven't already, please have your organization endorse RHYTPA. So we share this list of organizational endorsers when we do meetings with members of Congress. So say, if I'm trying to get my senators on the bill, their offices might ask me, do you know how many Virginia organizations support this legislation? And this is very important for them to know because they want to do what their constituents support. So if I can show them a list of all these different Virginia organizations that approve of this legislation, then they're much more likely to sign on as co-sponsors. So if your organization hasn't already, then please consider endorsing the legislation. The next thing you can do is go to our Take Action page and send a pre-drafted email to your members asking them to co-sponsor. So all you have to do is put in your name, your address, and you have the option if you want to add anything else, and then it'll send it off to the right offices for you. So very, very easy and quick. And then lastly here, you can use our social media toolkit to share about RHYTPA with your network. Ask them to do the same things that we're asking of you. Like I said, N4Y can't do this alone. We need support from as many people and as many sectors as we can to get RHYTPA passed. I know we all have wide networks. We work with, not just other youth homelessness providers. We work with all kinds of agencies, all kinds of organizations, and it's great to have this huge show of support for this bill. And do remember that N4Y, we're here to help you and support you in whatever you need in your advocacy. That's one of our biggest roles. So my info is here if you want help scheduling meetings, if you need talking points, fact sheets, whatever you need, please reach out to me. All right, so right now we're at the perfect time for you to start planning meetings or site visits right in your home district or state. This is a really, really powerful advocacy tool. So your US legislators are about to go on August recess. For the whole month of August, they'll be in their home districts or states. They'll also be back in their districts or states the week of September 22nd and the week of November 10th. So right now is a really, really good time for you to reach out to their offices, reach out to their staff to schedule an in-person meeting in their district office or maybe to invite your lawmakers and their staff to do a tour of your program. Site visits are really, really effective in helping lawmakers understand the work that you're doing. And in-district meetings are really important to that essential relationship building that's just a little harder sometimes to do over Zoom. I'll also note that, in-district advocacy is a great way for YABs to get involved. You don't need to send the whole team out to DC because your legislators are going to be in town. So this is a great thing that you could all do together as a team to show support for this bill and for your program. So we have linked here, and I think Kayla's dropping links in the chat like crazy, to our in-district advocacy toolkit. It's short and sweet. It describes step-by-step how to schedule these meetings, how to put together a site visit. But please, again, feel free to email me if you need help with any of that. Right. So advocacy and policy, really, really about relationships. This has, of course, always been true, but it is especially true since January of 2025. National Network for Youth and other national organizations have really been leaning in on any close relationships that our networks have with their lawmakers to protect programs like RHYA, for example. And we just can't emphasize enough how far those relationships have gone in that kind of work. And anyone can build these relationships. One thing you can do is start by tapping into your own network. You might find that someone you know or someone they know has a connection to your lawmakers. They go to church together, they knit together, they do whatever, play golf together. Some real life examples that we've seen include a city council member who knows the senator. This is a pretty common one. So if you know your city council member, that might be a good way to get a meeting or get a tour scheduled with your US representative. We've had providers with board members who used to work for the representatives, the House representatives, or even senators as well. And a number of senators' wives or senators' spouses who have volunteered at programs or attended events at programs. These are all really great leverage points that you can tap into to get an in as you're trying to schedule these meetings, do site visits, and talk about this program. But whenever you're preparing to meet with your lawmakers, send them a message, is a very good idea to know what they are passionate about, what they care about. You might find just with a Google search that, back when your senator was just a lawyer, they did pro bono work for women and children. So if you have a maternity group home, this is something that you could connect with them about. So really good idea to do research about your lawmaker to find out where you have overlapping priorities. And I'm sure there are at least some places where you do have overlapping priorities that you could really lean into for these meetings. All right. So again, just to reiterate, top things that you can do right now for RHYTPA: have your organization endorse the bill, send that pre-drafted email to your members of Congress. Please feel free to share about RHYTPA with your network. We have all those social media posts, blog posts, email blasts, all those things in that social media toolkit. And then highly encourage you to consider meeting with your legislators, especially when they're back for August recess or September break, when they're in those districts or states. All right. Any questions that we need to uplift from the chat?
Yes, a couple of people have been asking about RHYA NOFOs. So we knew you were going to ask this. We know it. We know it. We know it. Okay. So we did have a Republican senator meet with the Administration on Children and Families specifically about releasing the RHYA NOFOs. This meeting took place about 3 weeks ago. And the Republican senator's office was told by ACF that they were going to release all the NOFOs in late June or early July, and that they would include street outreach. And specifically, we are concerned about the street outreach program NOFO potentially not being released. And so this senator specifically asked about the street outreach program, and they were told that the street outreach program NOFO would be released along with the rest of them. However, we still have concerns. One, because like I shared earlier, current law says that this secretary may release funds for the street outreach program. So it does not say shall. So the courts cannot make HHS issue the street outreach program NOFOs because the law does not say shall, it only says may. So there's not a legal argument that would hold up in court. And we also heard that the acting secretary for ACF was looking and had asked legal, like, well, what funds do they have to put out? What funds don't they have to put out? And that they were told that because the law says may instead of shall, then street outreach program is a NOFO, that they do not have to put out by law. However, like I said, we've been doing a lot of behind the scenes advocacy because what we have seen is that when Republican members of Congress reach out directly behind the scenes to the Trump administration, they have been able to get them to change their mind or to do things kind of quietly behind the scenes. So we've been asking quite a few RHYA grantees that have street outreach program grants ending this year, who are in Republican districts or states, to please reach out to their Republican members of Congress, ask them to reach out to ACF and push for the street outreach program. We do not know what's going to happen. The other thing that gave us pause for concern is last week, I believe, is when FISB put out a recruitment flyer looking for grant reviewers for the RHYA grantees. And the flyer itself specifically said they were looking for grant reviewers for transitional living, maternity group home, basic center, and prevention. And it did not state the street outreach program grant in the flyer. So we've reached back out to our Republican Senate friends, given them that update, and asked them to reach out to the Administration on Children and Families again. So that's what we know, behind the scenes. And another reason why getting this bill to become a law is so critical, because it will change that may to shall. And if there is an issue with street outreach, this would fix that issue in law. So that is probably the most thorough answer I can give you. But we have been working quite a bit behind the scenes on that. I have not heard anything about when the submissions will be due. We have no idea what the administration is going to do. I will say we are going to provide if you're a member organization, we are going to provide a NOFO support session with our partners at the National Homelessness Law Center, provide some legal guidance, because we are anticipating these NOFOs to look very different, to be referencing executive orders that are anti-DEI, anti-LGBTQ. So we'll be providing some legal support and guidance around that. And also for members, we are going to be providing a data specific legal support session in 2 weeks, I believe. And so that announcement will be coming soon. I do think we have an exact date for our members. It's going to be the 9th, July 9th at 2 Eastern. So you'll be getting more details around that coming at you.
Maybe a couple ones that you answered in the Q&A already, but just to uplift for everyone. One was, if RHYTPA passes, what, if anything, does that mean for the future of the prevention demonstration program?
Yeah, so I mean, all demonstration programs, especially demonstration programs at HHS, are time limited. Usually there's just a few rounds, and then the expectation is that the learning is documented and shared and then implemented in some way. We were told last year that PDP wouldn't even continue this year due to a lack of funds. So we always knew that PDP was time limited. So we don't see that the prevention services program has a negative impact on the PDP program, because again, it was always time limited. Our hope is that the lessons being learned and the best practices being developed with the PDP are going to be documented and shared out. And so that's a good kind of guidepost of bright spots, of examples of strategies that providers could then implement with their prevention services funding. And then there was another question about, okay, so once this bill becomes a law, which you're all going to work with us to help make happen. That's what I'm hearing here in chat. Thank you all. So then what will happen is there will need to be an update of regulations. That's a very long process. And so that can take a year to 2 years. After the last reauthorization, I think it took like more than 3 years for the regulations to actually be updated. But what HHS can do in the interim is they can start implementing the law through NOFOs. They can put out guidance, and they can put out memos, like memorandums of, just memos on different topics. So they can start putting out, and kind of updating policies more informally, while the very kind of long process of updating regulation, in my experience, this big of a change in a law, it's likely to take several years, especially in our current context, well, there's a lot less federal staff to do the work, to be frank. I don't know if there's any more questions, but I want to let folks know that we have finished piloting our youth action leadership certificate program. It's an 8-week live virtual course through Google Classroom. It's for young people with lived expertise and their allies. They will gain skills in youth advocacy, how the housing and homeless systems work, effective stakeholder relationships. They'll learn how to facilitate meetings, how to manage projects, how to lead youth action boards. We've been hearing a lot from young people and a lot from providers that they really want to partner with young people with lived expertise. They really want them in leaderships positions, but that young people also need to be prepared and have the skills to thrive in those positions. So this was designed with that in mind. If you were interested, we are asking people to fill out the interest form, because the interest we have is quite a bit, and we're our community strategies team, who has developed and launched this in partnership with young people, are really trying to map out how we can try to get the certificate program to as many young people as possible this year and probably into next. So next slide. We have another webinar tomorrow we're doing with the National Homelessness Law Center, True Self, Sustainable Economies Law Center, on labor law and contracting for youth and young adults. So breaking down the different barriers to equitable compensation for young people with lived expertise. So sign up, there's a QR code. Also, we are excited. We've partnered with Baker McKenzie Law Firm, and we will be launching a hotline in July, 1-800-870-DOCS. Young people, service providers, liaisons can call in and get support for helping young people gain access to their social security card, birth certificate, valid government ID. And so the times are on there, but voicemails are welcome and all calls will be returned. Next slide. And thank you all. If you're not a member, we'd love you to become a member. We have a lot of member-specific sessions and webinars and resources and policy updates and peer-to-peer support and all of that. If you're not on our listserv, please join, and please follow us on social media. And our emails are here, so please reach out. We're here to support you. And thank you for all you do. Thanks, everyone. Thank you, Liz. Thanks, Trinity. Thanks, Kayla, behind the scenes, making it all happen. Have a good day, everyone. Bye.